I say this and I meant it. He was the best overall paramedic of his cohort. Now I saw him outside a petrol station, all malnourished without a shirt on. This is why I'm making this mini doc series, to educate you occupationally about the substances which affect their lives. So you, occupationalists, can't fall into the trap like he did. But there's more to the story. I always remember his photo as the best performer on the board at nursing school. It's something stupid that happened between us. Maybe it's guilt that got to me. Man, that relationship triangle. It just shows the best people crumble with the hardships of life. Occupational athletes, we all fall for these substances. The reason could be chasing that extra little bit of muscle, drinking after a hard day's work just to sleep, or sticking out like a sore thumb with your so-called friends. To break it down, to prepare, recover, and perform like that, like a sophomore track and field team. You get the parallels? It's oscillating in my head because for occupational athletes, addiction is the most common reason that's holding you back in life, man. This harsh, cruel world. I will be giving you all the substances, some of the reasons why other occupational athletes are taking these substances, and on top of how to avoid them, so you don't result in it ruin your lives, your progress towards your purpose and passion in life. Fundamentally, there are two ways of classifying substances: legal and clinical. Clinical, you are diagnosing and treating them as patients who are on the substances. This is where social workers to pharmacists to psychologists are trained to help you with assistance from the Diagnostic and Statistical Manual of Mental Disorders 4 or 5, as published by the American Psychiatric Association. The DSM-TR classifies them as alcohol, caffeine, cannabis, halogens, inhalations, opioids, sedatives, hypnotics, analgesics, stimulants, and tobacco. It legally basically manages and controls drug use, distribution, and other crimes that come with drug use. But this is monitored by an organization like the DEA in the United States. I know you probably never heard of that organization. The DEA defines these narcotics as Schedule 1, having no legal medical benefit to the person but highly abused, to Schedule 5, meaning the least regulated and the least abused. Remember, in clinical, we call them substances, whereas in legal and law enforcement, it's called narcotics. That's an important distinction. To make this more interesting, I'll be giving you archetypes of the people that use the specific type of drug, so it's easier to visualize. Check if you see yourself in them. Yes, before getting into the archetype, these ones I'm about to show you are the base level dopers, the ones you find on the streets. The most common archetypes you see in the series of mini docs talking about substance abuse. The Catholic Club whiskey guy. Most of these are heavy drinkers. Often drinkers are drowned in stress and anxiety, worrying about the board meeting, parent teacher meeting, and a French teacher, or their abusive partner, or suffering from side tension headaches. They're literally a joke in biochemistry. Before we end our day shift at 4 p.m., that half the country's already drunk. The mechanisms of action for ethanol acts on the GABA receptor in the brain, which is acted on by benzodiazepine. There's quite a few short-term symptoms when you drink any amount of alcohol. I'll be talking about you being drunk, so losing psychological control, being aggressive, doing stuff to that girl that you're attracted to, and memory loss about the event taking place. In the long term, the structure and how your brain works changes you from being an occasional drinker to being a chronically dependent one. Pregnant women are especially at risk to exposure to altering cognitive development and behavior in your children. College evening stoners. These guys are playing League of Legends and going out stoned with their friends, lying on the couch and proceeding to eat an entirety of the fridge. The main active agent is trialhydrocanabinol, which can cause feelings of elation and relaxation. It's a complex molecule. It has depressant, hallucinogenic, and stimulant properties. Taking a few puffs of this
directly into the bloodstream from the lungs. Once into the blood, it passes the blood-brain barrier and acts on the brain. The elation, or high relaxation, or calmness, almost like a spiritual practice. And in the long term, the effects are more drastic, like respiratory problems. Prolonged use of marijuana can make it hard to breathe, usually irritating your airways and making your bronchs and throat irritable. Pregnancy is shown to be exposed to THC and cause reduced child attention, memory, and problem solving ability. It could unfortunately pass through as baby milk. It could, I'm not saying, cause statistical cancer, but it's shown to also affect teenage brain development. Interesting that when you live it in an area with a lot of Rastas, they say it's a spiritual rite of passage, but because it gives you insight into your mind that are previously repressed. But that's not how the true path to spirituality. That often requires more mental effort and focusing on a long period of time, changing you in the process. Well, each to their own. The hyperproductive junior manager. This guy and works his literal butt off, going to the skin. A typical self-improver that spends his time every day improving. The main reason for the caffeine is to use it for his ability as a stimulant. It takes hours before enhancing your brain functions, your focus, attention, cognition, and ability, and which you imagine is quite a possible task with higher performance ceiling. So Red Bull and Monster Energy are so common in the adult and extreme sport athletes. These result in caffeine use disorder with long-term effects such as withdrawal symptoms, saying and believing you should drink less or stop completely drinking G Fuel or whatever purifier used to be sells you, insomnia. In my experience, because you use of caffeine within 8 hours, we're going to bed. Gastrointestinal issues like diarrhea. Yeah, a little back when I was a boy, we used to a bottle of Coke to help with diarrhea and gas. We were so naive back in the day. Anxiety, caffeine being a stimulant alters psychological, physiological states, or the prompt form of themselves of giving you an increased blood pressure, brain rate, and heart rate, correlating with an increase in alertness that goes unchecked and can lead to anxiety. Caffeine is the most used psychoactive drug on the planet. Everything has caffeine in it. Almost every product you find in shops. The average person in the U.S. and Canada has around 210 to 238 mg per person a day, and even more during the night. Remembering, K Fuel, Prime Energy, Coca-Cola, Nestle, and drugs like Panadol, caffeine is one of the most overproduced and farmed items you find in the short term, along with seed oils and wheat. There's so much of it that our consumerism and plain ignorance, given how much people are dependent on it. You see, this is just part one of a multi-part series of mini docs detailing the things that hold us back from achieving the perfect winning performance. If you want the story of addiction or know anyone who's it was through, put it in the comments. This documentary is supposed to enlighten you on the challenges that may face in the broken world, but there's always hope. See you in part 2.